Name of today's video is use of Gestalt therapy for ADD. Seems very simple, especially that ADD is one of the most popular terms used to describe behavior of younger children. I met that term 35 or more years ago when I first time started to work in kindergarten back home in Yugoslavia, in Zagreb, capital of Croatia, where I worked with probably 30 to 40 teachers, and we together worked and figured out the ways how to help different kids that had difficulties to integrate in groups. Some of these kids are probably now in their late 30s. It's amazing to think about it. So today I would like to talk a little bit about what ADD means, why is it important to work in a right way with them, what will happen if we don't, and also I would like to do something that I never did before, and that is I will bring my imaginary friend, one of my little friends, and put him in a chair, and I will talk to him the way how I usually talk to those kids. So let's start with the definition. ADD, what does it mean? Well, it means a different thing for different people. If I ask what ADD means a little girl or a little boy who is diagnosed with that, they will say it in their words, but the meaning would be it's a delightful dance of abundance of attention. They usually say it's a deficit of attention, but actually it's a sufficiency of attention. Those kids have a special talent to deal with several things in the same time. They are talking to you, they are playing with their phones, they are fidgeting, they are looking at the back, and always ready to interrupt everything that's going on right now for something different. In some settings where are clear goals and agendas, that can be a problem in groups. So a teacher will have the same definition of ADD as attention deficit disorder. That's the way how they describe their difficulties to do with their kids, to make a good contact, to build strong relationship, to have some working atmosphere. And they will put all the blame on kids, and they will say, we need to medicate them, or we need to fix them in order that they can come back. And often they will say to parents, take them to a psychiatrist and don't take them back because they are diagnosed and given medication. For a parent, ADD means another domestic difficulty, with phone calls from school, with some suggestions from neighbors, friends, family. It becomes a problem to be solved. And very often they don't use it as actually an opportunity to get to know and enjoy their children more, because they show much more of who they are with their behavior. So they need some help with that. For most mental health professionals, ADD means another diagnostic defense. When they say ADD, for most of them, that means they avoid their inability to influence and becomes tombstone of their incompetence. Not challenge how to engage with their children. And so ADD is very, very connected with medication. And people who know me easily can assume that I'm against medication. And I'm not. I am for medication, but conditionally. There are two conditions. First, it cannot be excuse for not giving the effort to know a child better and to help him to learn certain skills, techniques, to enrich themselves with some important experiences so that can increase their awareness and ability to cope with the condition they have. Very often, adults who knows that the child is on medication will stop to do anything about it, and they say, oh, he's now on medication, so we don't need to do anything. The second condition is very important, and I would say that the day that a child starts to take medication should be the day of figuring out how to stop the medication. What we need to do, and to do it as much as we can, to get the child off the medication. The third condition is it's never child that has to have medication. It's the circumstances. Not very active and knowledgeable and experienced teacher, plus confused, maybe overwhelmed parent, not experienced and not skillful therapist. All three together will create a situation where a good therapist, good psychiatrist can help with a little doses of medication until those three catch up and find a way to work together and help a child without taking a medication. Why is it so important to even talk with this? Because somebody might say it's not so important because all ADD, or 99% of ADD problems, are developmental. So, 9 years old cannot sit still in his chair, he goes around, he interrupts the teacher, he plays with something else while the teacher is talking, he's talking to his friend in the next. So all this will disappear. When they are 15, 16, it will not be there. But what will stay there if we don't treat these children with enough attention, respect and understanding, all corrections that they get will build in them feeling that something is wrong with them. And when they are convinced that something is wrong with them, when they are 15 or 16, they will find another ways to prove it. They will not do the same as they did as 9 years old, but they will do something else. So it is important to give them help of AAA. It's affection, affirmation, and admiration. So that they can get it from outside and incorporate in themselves, so that they do the same these things to themselves when they are growing up. It's also important that he can practice triple C: compassion, cooperation, and choice. When they practice those three things and get triple A and practice triple C, they can build healthy personality. What if it doesn't help like that? Well, if they don't have their developmental needs met, it will stay with them forever until the moment when they do some therapy and corrective work. If they don't, most of them are very smart, very intelligent, they might become very knowledgeable, very rich, powerful people, but still behaving like 9 years old. They can be very successful in our world. They can be even presidents. The most powerful, have a position of most powerful person in the world. And still, if you watch the person, how sensitive he is on any little remarks, how much hungry he is on attention and approval and appreciation, how hungry he is for power. And even when he has that, you don't see any changes, because those changes didn't touch the part that only we can give to ourselves. And we can have a possibility to give it ourselves if we were given when we were children. So that could be a really wonderful experiment in somewhere, in some country. Some boy like that would become a president, and we can have wonderful human, psychological, real life experiment what is going on. So what we can do, to help as many kids as possible to stay healthy and happy and enjoy themselves for the difficult stages. What I'm doing in my job, and I almost every day see some of these kids, I use Gestalt therapy. I will not talk much about Gestalt therapy here. I talked about them in my different videos, so I will just say a couple of words: contact, dialogue, awareness, presence, acceptance. This is kind of words that pop up right now, that guide me, that when I work with us children. And now let me do something that I never did before. I will introduce you with my 9-year-old boy, my friend, who was brought by his mom. She's sitting there, and the boy, let's call him Donald because it's his name, came here, and I will talk to him and try to make some contacts that are usually not there in his real life. Let me correct this: in his usual life. This is real life too when he comes to see me in my room. So there's a lot of things here: my weights, my other exercise devices, chessboard, cards, some food, M&Ms on the table, books, colors, papers, Legos. And usually when they come in my room, and it's never really in order, so it's even more attractive to them, they try to touch or ask everything. And this is how I would start to build and to show to parent how they can also engage with the boy. So Donald, you and me, we were seeing each other now for a couple times. We played ping pong, we played chess, we engaged in discussions and talkings, and you talk to me about sport and what you like and what you dislike. And we are pretty good in focusing and paying attention to different activities that we were involved together. So today I would like to do something, and I see you are playing with your phone, and that is okay. And I also see that you immediately put it away, and when I said you are playing with your phone, I didn't mean to judge you or criticize. I just noticed that you played with the phone. And I noticed you look at it again, and what about if you just put the phone on the table, just for 2 minutes, nothing more, just so that we can talk. Okay, thank you for doing that. And I see now you are looking through the window, and your head is a little bit low. And I also noticed the moment when I told you that you lift up your head. And it seems to me like you really want to cooperate with me. And I see how your left leg is fidgeting right now. And now you stopped. But now you're playing with your hair. Your right hand is almost lost in your hair. And you stopped that. Well, I would like you, just for a moment, instead of waiting for me to notice something on you, I would like you to look at me. See what I am doing. How am I sitting? You can see my hands, the way how I talk. And I see immediately how your posture changed. You seem a little bit more up. You're looking at me. And your fidgeting is very, very little. And now you are playing with Legos. Where did you find that piece? Yeah, it's nice. Thank you for putting it back. Yeah, that's what I would like you to, be empty-handed, just relaxing. So what we are doing here is a little experiment with objectless attention. So we are doing together, just being with each other. And at this moment I see that your legs are on the ground, your hands are in your lap, and you're really looking at me. Now we are there where I want us to be, just for a moment to enjoy peace. And I would like just to stay like that for a minute. No more than a minute. Just enjoy this peace, this would be silence if I don't talk. And you look at me, and I look at you, and we are together. And I want you to really enjoy this moment. You know what you are right now? You want me to tell you? Yes? You are the master of peace. You are the master of your peace. All the fidgeting, all the movements, all these urges to do something, everything somewhere else. It's you, me, and peace. And I'm so grateful to you. I really enjoyed it. And I see your mom, she's looking at it, a little bit surprised. And I would like to slowly end this exercise and end this experience. But I don't want you to stop having it. And you can always come and remember that if you need. Is it okay if I talk to your mom right now? Thank you. So Mom, you saw me and Donald, and you saw how playful it can be to invite him to the place of the peace. And you told me first time when I met you and we discussed his troubles, you told me he's never at peace. He's always in energy and he's always doing something else. And I trust your experience, and I believe you saw it like that. And in the same time, I'm very thankful for you for giving me opportunity to really work with him, and I don't know how long it lasted, maybe a minute. It doesn't have to be more. But this peace, this moment of mutual connection, being together, can be built on. On this 1 minute you can build on, and maybe do it once a day, maybe twice a day, just sing in a silence. And I did it before with some of my kids, and with some of them it really worked. And well, I so enjoy this piece that I feel like I would like just to stay with this peace and relaxation and gratitude to be with two wonderful people, and that we really met each other in a right way, and that we can all have it all together. So let me finish this video with just a couple sentences what I just did, or what I just tried to do. I never did it before. Not Clint Eastwood, to put somebody in the chair so easy, without knowing that actually when we put somebody in the other chair, we do it only to talk about ourselves, as I talked about myself at this moment and in this video, trying to show the way how I work with people without assuming that anyone needs or should know something about those two imaginary friends. So what I did is trying to create safe space, non-judgmental attitude, using every behavior as a wonderful opportunity towards knowing another person, and also teaching other person or inviting other person to love themselves as they are. And then more peace we create, there are more opportunity that a person that I work with will attach positive and optimistic thoughts about situation that they are in. And I don't know how did it looked from outside, so thank you for watching, and every feedback will be appreciated, as always.